Hello and good afternoon, ladies and gentlemen. Thank you for your kind time and attention. I am Mohammad Arshad, and today I would like to take this opportunity to share our study on behalf of my co-authors. A population study on higher frequency of hospital-acquired infections in admissions with alcoholic hepatitis at academic versus non-academic centers. The authors and contributors to this study have no financial or any other kinds of disclosures to make. Alcoholic hepatitis is a unique syndrome characterized by high short-term mortality. The outcomes in alcoholic hepatitis regarding the impact of academic status of a hospital is unknown. So in this study, we compared outcomes of alcoholic hepatitis admission to academic centers versus non-academic centers. To address our research question, we queried National Inpatient Sample Database on hospitalizations between 2006 and 2014 in the US for admissions with alcoholic hepatitis admitted to academic versus non-academic centers. The study population was stratified to three time frames: from 2006 to 2008, from 2009 to 2011, and from 2012 to 2014. The main outcomes included in the study were in hospital mortality, hospital resource use, length of stay in days, and total charges in US dollars. Our results reported that a total of 62,136 admissions were associated with discharge diagnosis of alcoholic hepatitis. The admissions to academic centers increased over time. In a cohort of 53,264 admissions, propensity scored matched for demographics, pay status, and disease severity. Admissions to academic versus non-academic centers had higher frequency of liver disease complications, which were namely esophageal varices, ascites, and hepatic encephalopathy. And also they had increased frequency of hospital-acquired infections, mainly including Clostridium difficile and ventilator-associated pneumonias. The admissions to academic versus non-academic centers were more likely to be from an outpatient hospital and also were more likely to be seen by palliative care. The use of endoscopy, dialysis, and mechanical ventilation were similar. On multivariable logistic regression model, after controlling for demographics, acute on chronic liver failure grade, and calendar year, inpatient hospital mortality was similar irrespective of academic status of the admitting hospital. The inpatient hospital mortality decreased over time, and acute on chronic liver failure was its strongest predictor. A total of 63% and 22% of the patients were discharged to home and skilled nursing facility respectively, without any differences on academic status of the admitting hospital. Our study design, while having the strength of being a large sample size from National Inpatient Sample Database, is limited by its retrospective design. I have now come to the end of my presentation. In summary, admissions to academic hospitals versus non-academic centers with alcoholic hepatitis have higher frequency of liver disease complications and hospital-acquired infections with longer duration of hospitalizations. The overall use of palliative care remained low, however, this is higher in academic centers. In-hospital mortality and disposition of patients surviving hospitalizations were similar in both groups. In the future, prospective studies are needed to reduce hospital-acquired infections among hospitalized patients with alcoholic hepatitis. Thank you.